In September 2023, Jamie's Fund sponsored a professional development workshop in Kampala. We had intended to hold a workshop every year, but COVID had disrupted all these plans. We brought together 28 people working in mental health care from across Uganda. We met in a wonderful conference centre in the centre of Kampala, and everybody appreciated. There was a combination of talks and lectures by both Ugandans and people from UK, and there was a lot of good quality discussion and sharing of ideas and experience. It was rewarding to see how ideas have been developed in the different localities. Some of the speakers were colleagues that we have been working with over the past number of years, and it was encouraging to see the development in their experience and leadership. We were particularly pleased that our online session, led by two international experts in learning disability and neurodevelopmental disorders, worked well. Later, we had a celebration meal. After the meal, Hugh gave a speech to all the delegates.
Again, it was really important for us that we didn't come and tell you how to do it, and that the training that was done by Ugandans for Ugandans, and you've been fantastic at this. You have been doing amazing work with some support from Jamie's Fund, but a lot of it has not required us to do it, but we've been very moved and impressed by the work that you have done and continue to do. That very sadly we have decided that we're going to close Jamie's Fund at the end of this year. It's not a decision that we've reached lightly, and we're very sad to have to announce that, but that's the reality of where we find ourselves.
I appreciate Jamie's Fund. Maybe for those who don't know me, I'm called Yusuf Pude. I work with the Winnie Community Hospital in Kanungu District. Personally, I've seen the work of Jamie's Fund right from the start. I'm particularly impressed by one thing that Jamie's Fund, as Reverend Hugh said, the community mental health approach is what I just want to talk about, and which I want to commend Jamie's Fund for. I've been in the service of mental health here in Uganda for the last 23 years. But I can testify that the work we've done as far as MHGAP and the community mental health service provision is concerned is very good. I found it very cheap, easy to provide. It doesn't need a lot of other resources, as you've said. You can easily partner with other health workers, already existing services, still become useful under this arrangement. I really want to thank you so much for this idea.
The nuns kindly provided a celebration cake for us to cut, and then I interviewed a number of the people attending the workshop.
Good afternoon, everyone. My name is Lucky Simproza, and I'm a mental health nurse currently working with Rubaga Hospital. And I would like to thank Jamie's Fund and Diversity Development for the opportunity granted unto us to attend this development workshop.
Good morning, I'm Amron Scholastica from Kumi Hospital. I am a PCO. I want to thank the organization for this professional development training. It has been so good. It is going to support us, but now the knowledge I am getting, it's going to help me further manage these clients. I really thank you so much for supporting us.
Julius is my name, coming from the eastern part of Uganda, working with Benedictine Eye Hospital. Eye Hospital, Jamie's Fund has helped us to bring on board community mental health on top of our epilepsy outreach program that we're doing. Initially, we were only doing the epilepsy outreach clinics, but we had patients who had other psychotic issues but who were not able to do much. We could send them to the government hospital where in most cases they don't get even the drugs. With Jamie's Fund coming on board, we have been able to start complete mental health outreach clinics running well. With the support of the drugs from James Fund, we're very grateful. Not just drugs, James Fund also helped Benedictine Hospital to improve our transport system into the community. They bought for us 2 Honda motorcycles, which are running and are in very good conditions, helping our field workers to go and see patients in the community. And then we did a lot of community sensitization on leaders about community mental health. It was tremendously very, very, very helpful. And everywhere you go, people are appreciative about it. Okay, just to be very clear, our appreciation goes to the Diversity Foundation. A big thank you to you. Thank you for having good hearts. Thank you for thinking about mental health patients in Uganda. You have made our work stronger. We feel much more stronger than we came.
Would you all like to wave to me? We all said farewell to each other and set off in different directions. Some people it would take more than a 12-hour journey to get home, but for others they lived relatively nearby. The trustees split into 2 groups, and Maureen and I travelled to the east of the country. Travelling around Uganda, you cannot help but be conscious of the challenges of travelling on the roads. In the towns and cities, they're often very congested. First, we went out to our community clinic at Mukono, and the access was not great on a wet day. As it was so wet, people were relatively slow in coming to the clinic. Considering they had to walk over wet, muddy roads, it's not surprising, but still a reasonable number of people attended. The health centre is fairly basic, but it is all the medical care that people can access locally. They bring a stock of drugs with them for mental illnesses and epilepsy. And each patient is seen in the clinic by a psychiatric clinical officer. This is the team that came with us and includes Cesar, one of the PCOs we have sponsored. From there, we travelled further northeast up to Kumi Hospital, and the roads gradually deteriorated. We were taken out to our community clinic, and they normally access this by motorbike. It was a bit challenging getting there by car. The clinic was held underneath a mango tree, which is a good source of shade. Confidentiality is not a problem, as everybody knows everybody else's business. Many people express their appreciation for the community clinics that Jamie's Fund has enabled. From there, it was travelling back down to Kampala, back along the same tarmac roads. We were pleased to have a short break before getting on the flight back to UK. We are very grateful to the many people who provided support and enabled the professional development workshop to take place, and feel that we have left the future in good hands.